Your patients want a wider smile. They might not know it, but they want that. Nick's smile has changed unbelievably from the former to the latter. We could think of the width as the undefinable X factor we all crave for our smile. Having straight teeth is fine, but a narrow palate can dramatically reduce the aesthetic impact of a smile. So, how did we get here? Well, let's start from the beginning. Come on, make a skeletal diagnosis. What's the first thing that comes to your mind when looking at a face like this one? The most important one, do not think of the details. And yes, it's the hyperdivergency. Nick has got a long lower third of the face, which will inevitably come along with a tendency for open bite, right? Good. Let's see what's inside. Seriously, sometimes it's even hard to look at the lateral radiography and think of some facial features we did not get from the face alone. When a patient walks into your practice, look at his face, at his chin, at his masticatory muscles, at his nose base, and you'll get very close to an accurate skeletal diagnosis. You think you need to make a cephalometric analysis to say he's hyperdivergent with a tendency for open bite and a mild class 3? Believe me, you do not. Just trust your eyes. Well then, here are the teeth. There are quite a few problems here. He's got a narrow upper arch, which is giving way to bilateral crossbite. Also, a narrow palate means less space for the teeth to erupt. In this case, we can presume the lack of space being one of the causes for the impaction of 13 and the crossbite of 22. As we also need some good news to keep our morale high, let's say both molars are in first class. So, the real point here is to get a wider smile. But he's 15 years old, a bit too old for a rapid maxillary expansion, right? Actually, not. Here, I used the rapid maxillary expander bonded on the sixths, and I expected a lot of dental tipping, which is okay, and some bone expansion, which is great. This is the key, the secret of the aesthetic success in this case. You might have noticed the two huge glass ionomer bites on the lower sixths. These are helping correct the crossbite of 22, which is stuck in the lower arch, by disclosing the arches. Given the relative good alignment of lower teeth and the fact that we didn't really want to cause any proclination in the lower arch, we decide for now not to bond the inferior arch. After the rapid expansion protocol, we bond the upper arch and put a 013 Q-Night tie in place. We use light open coils to open the space for 13 and 22. The latter is partially engaged with the metal tie to the arch wire. This helps to prevent undesirable movements in the adjacent teeth. After 3 months, we have enough space for 13 to erupt. Therefore, we get rid of the coil, which has predictably derotated 12 and 14, and we put a 016 SS Australian wire with 2 offsets to keep the space from relapsing. We also start the derotate 25, which has some sort of enamel imperfection with an elastic power chain. After 2 months, 13 is erupting. In fact, vestibular canine impaction is very often caused just by the lack of space. On the contrary, palatally impacted canines have a more complex etiology. In the meanwhile, 25 is being derotated with a force pair as alignment goes on. Once we reach alignment on an 18 by 25 Q-Night tie, we find that the derotation caused by the open coil on 14 is hard to fix. I then choose to help it with a power chain anchored to a surgical hook in order to avoid any other undesirable effect on the canine. At this point, we need some more Overjet, as the tendency for third class starts to appear. In this case, we choose to use third-class elastics from a 19 by 25 SS posted wire bonded directly on the lower teeth. This will prevent any sort of vestibularization of the lower incisors, something we would surely get if we were to bind every single tooth. We also put a 19 by 25 SS on the upper arch, which has started to cause diastemas due to torque expression. But that's okay, we'll fix that later on. After 3 months, the elastics have created the overjet we wanted. Now, we can close the upper arch diastemas with a power chain without risking a zero overjet situation. We then put an elastic power chain which closes the upper spaces as planned. At that time, I noticed some derotation of the lower premorals and canines, so I decided to bond only those teeth in the lower arch. With a 0.16 Australian wire, I make a tight bend back, which retracts lower incisors just a little bit, somehow aligning them against the bonded lingual steel wire. At this point, we had 0 spaces in the upper arch and a good overjet, thanks to the tight power chain placed under the brackets. We still had some sort of problems with 25 though, so we used an elastic power chain to try to derotate it, but that didn't really help. These are the final photographs, and for sure, the improvements of his smile's aesthetics are not given by teeth alignment, but by the palatal expansion that we have made. The settling of 24 and 25 is not perfect, but just like good wine, it will improve over time. Nick still has a long mandible, and these are the traits that make each one of us unique. But boys, he was so happy to see his new, white, broad smile.